Ultimate Health on Joy 99.7 FM. Every Sunday, 2:05, we're live. As I said, we sneaked in early. Tell a friend to tell a friend. Live on Facebook and YouTube. That's right, my name is Nortey by nature. Notoriously naughty. Impacts on your health and your well-being, will definitely bring in the practitioners, the professionals to talk about it. We give you a bit of praise and music, and sometimes we get naughty. Thanks for joining us. Let's take a bit of this from Team Eternity. They seem to be hiking all the trends,
Joy 99.7 FM.
Yes, I'm in the praise mood. They've been arguing about this song, fighting over it. As Maya Angelou will have it, yet still I rise.
Joy 99.7 FM.
Yeah, leave me alone. Let me give the praise. But it is Ultimate Health on Joy 99.7 FM. Today we're looking at geriatric dentistry, special care dentistry for the elderly. And I've got a guest from Platinum. Platinum Orthodontics and Advanced Dentistry. Yeah, they're in the Airport Hills. I've got their lead clinician, consultant orthodontist, Dr. Nelvishi Akutu. Doc, you're welcome.
Thank you.
You've been scarce. You've been missing a bit, huh?
Yes. I think we have had the team here,
The
but
team-
not me for
Right.
a while.
Yeah. I had the team in March. Yeah, we did quite a lot of stuff with them. And today we've grabbed you, the lead clinician, specifically also because you're marking a significant milestone.
Yes,
Ah.
it is our 10th anniversary.
Wow.
So it's amazing that we started 10 years ago, and we are really celebrating. So the official date was the 21st of June, Friday. So we are definitely in an anniversary celebratory mood.
Wow. I'm just looking at your smile as a dentist, and you pledged when you started to bring high class, international standard dentistry to the doorstep of every Ghanaian. How's it been? 10 years.
It's been awesome. It's been amazing. We feel that we have done what we set out to do, although there's still a lot more to do. But rather than the figures, what is heartwarming is the people, the clients that have almost become like family. And it's really strange to now think that there are certain families like the Mensahs who we've been treating for 10 years now, and the kids have now gone off to university but still come back over summer and Christmas, etc. So it's actually nice to have formed a platinum community and a platinum family, which we are aiming to keep growing and have better and more interactions.
Right. Great. We'll be lacing, folks, our discussion on geriatric dentistry with this anniversary bits and pieces. But really, after discussions with Dr. Akutu, I decided let's do, we always talk about children learning how to brush their teeth and all that. But we do know that our demographics are changing, right? Life expectancy is higher generally across the globe. And we do have a significant proportion of the elderly that need dental care. Am I right?
Yeah, so I will thank Nortey for actually bringing this up, because when you start looking at the demographics, by 2030, 15% of the population will be over 65. And then by 2050, it will be 30%. So that will be looking more like 1 in 3. Now, I read and chuckled a bit about the definition for geriatric dentistry because it is above the age of 65. And I know that there'll be loads of people who do not feel as though they are that old past the age of 65.
Be very careful.
And yes, it's not me who's saying this. This is the American Dental Association's definition. But we must remember that obstetrics have geriatric mothers at 35. So
Right.
I'm pushing some of the blame away from this. But what that age group encompasses is a whole range. So another thing that has happened that has become, which I think is more pertinent, is an assessment of the frailty and the dental needs of the individual.
Okay.
So rather than it being age-based, there's now a tool where you actually assess various things to actually categorize them as needing special care
Right.
in dentistry.
Okay. So, folks, that's what we're looking at today, right? Specialized care or special care dentistry for the elderly. Yes? By definition, well, we can say 65 and above. It's pretty close to me. I don't like that. But that's the reality. I have an elderly mom, right? And yeah, she brushes her own teeth. Do we check? Do we know? And of course, once you get into that age group, depending on your family and the context, all these things may be overlooked, ignored. Right? Sometimes you're not eating right because you can't choose certain things, or certain things are difficult for you and therefore you no longer prefer them. We tend to say that she's stubborn, she's this and that. So this is a whole area we need to look at. So is it special? I mean, is it really? I mean, you've established the context and the framework, but is it that they will present, or their conditions or their oral health care needs will present differently?
Well, I think that there are, you've basically touched on it. And if we look at the typical elderly patient reporting to Platinum, you've usually treated all of the children. And dentistry is interesting because it's the only thing that parents tend to send the kids first.
Right.
So you've done all the kids, you've done all the abrasives, etc. Mom and dad have been in 10 times, 15 times. Then once the kids are sorted out, mom and dad will say, oh, okay, it's my turn now. But for the elderly, we tend to see them when there's an emergency.
Okay.
So when they are in pain. So it's very, very rare that they are coming in, routinely. It always seems to be triggered by an event, a broken tooth or something like that.
Okay.
And then we get the call to actually book them in
Right.
and to see them.
Okay. So they'll present, right? We'll get into the presentation and the common concerns, right? Or areas of highlight for them. But in presenting, I work in Kolebu, and I always feel awkward when our elderly come to our facilities, right? We don't seem too age-friendly for that demographic, right? I see them running around trying to pay here, do this, do that. Let me just ask, with specific reference to Platinum, I've got you on the spot here, but what kind of accommodation, as they call it, right, do you have for this demographic, this age group, right, that makes them, should I say, consider you as age-friendly?
So I think it's interesting because we had the luxury of purpose-built in Platinum. It is totally wheelchair-friendly.
Okay.
So from driving in to, there is a ramp,
Right.
and then everything on the ground floor is wheelchair accessible.
Okay.
So that is immediately quite a differentiator. But the other things are the fact that there's actually a lot of glass in the building.
Okay.
And that allows us to actually start our assessment very, very early on. So did they get out of the car themselves? Were they aided? Are they walking? Did we have wheelchairs available? Did we have to offer an actual wheelchair? Even when they're talking to the person with them, whether it's a carer or a relative, is everybody leaning in towards them? Is there actually a hearing impairment that we are just coping with? And as they come through, you have to think about the visuals. So what I always say is that we are quite a high-tempo practice, but when we are dealing with the elderly, that needs to actually calm down. The other really crucial thing is what you do beforehand. So all our letters ask our clients to arrive 5 minutes before, but the elderly will get a phone call requesting that they arrive 15 minutes before to give us the time to actually look at them and get the information that we need.
Okay.
But the crucial thing really has to do with rapport building. And once they are within the environment, that becomes the most crucial factor. Just like you, I also have elderly parents, and my dad in particular is a doctor himself. And I'm shocked at how he gives his own history depending on the amount of rapport that he has established with the clinician.
Right.
So it becomes really, really pertinent that when they come in, we are going back and finding out a bit about the person,
Right.
a bit about their previous, occupation, etc., but also what they like to do, what gives them joy, what gives them pleasure, and situating them as a person before we start to actually deal with any problems.
Right. Okay. A lot of patients say that, well, this is missing. It's really the business of the day. Why are you here? What's wrong with you? When did it start? How does it feel and all that? But you're saying that essentially, and perhaps specifically for this age group, you need to do more of that to get them comfortable, to get a certain context, to also extend your own assessment of how they understand why they've come there, what the history and all that is. You build that with them.
Yes, and I think that with this particular age group, that becomes where you actually succeed or fail. Because a lot of the time we have to realize that there are some cognitive impairments as well. So, they may not give you all of the history in one go. You have to probe a bit deeper, but it's in the context of who they are
Right.
and what they're going to allow you to actually deal with. Really depends on how comfortable they are and how much confidence they have in you as a practitioner, which is based on whether they feel that you are interested in them as a person.
Okay. Great stuff. 18 minutes past the hour of 2 on Joy 99.7 FM. I'm enjoying this. I'm settling in. But we're talking about geriatric dentistry, if you want to call it that. But special care dentistry for the elderly, targeted, age-friendly. And then we'll be looking at the kind of problems they present with typically, right? Though there are a whole range of these things. And I've got in the studio with me Dr. Novishi Akutu. She's the lead clinician and a consultant, a very well-decorated consultant orthodontist with the Platinum Orthodontics and Advanced Dentistry practice in Airport Hills here in Accra. We're looking at this because very often we forget. I mean, mom is up, she's well, she's taking something and so on and so forth. But these are routine things. We brush our teeth and the dentist will tell us, we can see a lot through your mouth, right? And if we're not checking and we are ignoring to check, then a lot of things may be going on and compromising your health and well-being. That's why we're looking at the oral health needs of the elderly. If you have any questions, concerns, we're live on Facebook and YouTube. WhatsApp is 055 11 11 997. You can ask the questions yourself or you can put them through me, through my mouth, which is free of interference from Dr. Akutu at the moment, right? So you can ask those questions. And have you ever considered yourself, if you are in that category, are you looking after your teeth properly? Are there things that have changed that nobody has bothered? If it's your eyes, if it's your movement or motor coordination and all those things, yes, they'll take you to a doctor, but your teeth, perhaps not. Share with me. WhatsApp 055 11 11 997. Oye Inafienya is confessing to missing the program last week. You are forgiven, right? But we'll find a fine for you. But thanks all of you for tuning in. So let's come back to the business. So we've made this person comfortable. We've done our, should I say, unobtrusive observation and assessment of them, their capacity. We've been wheelchair and everything friendly. They are in our space, right? We're supposed to brush our teeth, okay? Many of us, at least, we try, okay? Twice a day, we're told, and so on. Do these things, these recommendations change for the elderly?
It changes depending on the type of medication that they're actually on.
Okay.
But if we step back, you actually touched on motor skills.
Yeah.
And we know that the actual movement to toothbrushing requires some skill
Right.
and some manual dexterity.
Okay.
So all of a sudden, we have the elderly who may have osteoarthritis, they've got nodules in their fingers, etc., and the ability to actually grasp the toothbrush
Right.
has been slightly impeded. They can still do the actual motions, but how effective are they actually being?
Are they really cleaning?
Exactly. So now we need to change things around and look at that. It's significantly more elderly friendly to increase the size of the handle of the toothbrush.
Okay.
And if we want to go a step further, then the easiest way to do this is by switching them to an electric toothbrush. The electric toothbrush is going to do most of the movement for them and is significantly larger.
Okay.
With this same group, when we're talking about oral health, we keep talking about brushing in between the teeth and flossing. But flossing for the average person is quite difficult. And in the elderly, for them to do it efficiently, it's almost impossible.
Right.
So now let's move from that to using water flossers, which are again quite bulky, and it just requires them to place things in the right position,
Right.
and the actual action is done for them. We also look at different toothpaste. So when we're looking at the elderly, we know that above the age of 65, almost 70% of them will be taking at least 4 different types of prescription medication. And some of the medications and the interaction will lead to a dry mouth.
Right.
And saliva is crucial in cleansing the mouth and actually lubricating things and making them even feel better. So without the saliva, we're already in trouble.
Okay.
should they be using the same toothpaste, or should they be using toothpaste that are at a higher fluoridation?
Okay.
So all of these things come into play before we actually start dealing with the problem that they usually attended with.
Right, great stuff. But you bring in so many dynamics, right? Some of the, should I say, more appropriate and more effective tools you're talking about, electric toothbrush, water flossers, and all these kinds of things, are not typically that accessible. All right. I know I'm talking to Platinum, but they are not typically that accessible. But if we broaden the discussion, then that suggests that there's a whole big chunk or percentage of this age group that probably are trying to maintain their oral health, right, with these inefficient tools and without the knowledge of these, should I say, deficiencies.
Yes.
Right. So I don't know that my motor coordination, my fine motor, how I hold the toothbrush is now compromised because I'm older. Maybe my vision is also challenged and so on and so forth. So what would you say to those who are listening to us and are quickly going to ask us, well, how much are these things that Dr. Novish is so, fluently talking about? What would you say to those who fall outside this range?
I think that there is something that everybody can actually do.
Okay.
So whether it's sipping water frequently, whether, those who have fans in their rooms and ACs, we need to remember that these are all dehydrators.
Right.
And the fact that a lot of the elderly tend to sleep with their mouth open, even that is going to have a desiccating effect.
Right.
But toothpaste itself is not ridiculously expensive.
Okay.
It's just making sure that your dentist is prescribing toothpaste that has extra fluoride, or using a fluoridated mouthwash at a time other than when you brush your teeth.
Okay.
So all of these little things can end up making a big difference.
Right.
And it allows for maintenance, which is so crucially important, so that we're not always having to do treatment, which can be exhaustive for this group, but that we are being more proactive in prevention rather than just focusing on treatment.
Okay. Great stuff. If you just joined us, this is Ultimate Health on Joy 99.7 FM. This and every Sunday we have Ultimate Health, and we bring all the important issues that impact on your life and your well-being. Today we're looking at dental care for the elderly, right? What can we do to make sure that they have the optimum level of oral health, and then also we can prevent some of the diseases and conditions developing? If they have developed, how do we handle this group of people who are compromised in many ways? We are not saying and suggesting that after this age, you are automatically compromised in these ways, but there are important clinical and practical considerations. That's why we're looking at this with Dr. Novishi Akutu of the Platinum Orthodontics and Advanced Dentistry here in Airport Hills. If you have any questions, concerns, WhatsApp is 055 11 997, and we're live on Facebook and YouTube. They are celebrating their 10th anniversary of delivering on their promise to give you cutting edge, high class. Yes. Yeah. High class in terms of what you are getting in delivery, right? Dental care. 10 years of that. Okay. I'll sprinkle a bit of Dr. Akutu's background shortly, but if you have any questions on the topic, that's very, very important. Now, you've got this theme you splashed at me. Keep across smiling.
Yes.
Yeah. What does that mean? Even though you are smiling, what do you intend to do before we come back to the elderly?
So with the Keep Across Smiling, hashtag Keep Across Smiling, that is what our 10th anniversary theme is. And that allows us to actually look at a range of activities. We have always done things with schools, but we're going to intensify things with schools. But as I sit here and we have this discussion, I'm also realizing that we should be looking at the elderly and trying to get more involved in groups and specific targeted information towards that group.
Right.
So the Keep Across Smiling is just about maintenance, is just about giving us an opportunity to work with different communities and different sectors of the community
Right.
to improve their oral health.
Okay, great stuff. And you see, the thing I like about Platinum, okay, maybe it cuts across other places, but I particularly like that about Platinum. They're such a young, relatively young team, right? And I see all sorts of old faces, of course. They pass through medical school or dentistry and so on and so forth. And they're all there, very, very confident, very, very competent. It's an amazing team you have. Is it that do you look at age when you're recruiting and retaining? But you have a very, very dynamic young team.
Yes, we have a very dynamic young team. We have a lot of specialists on our team. So we have 7 specialists. We don't look at age, but what we look at is the willingness to grow in terms of their profession and the willingness to try different things. So we employ for attitude and then train. And the attitude needs to be that you are willing to dedicate a proportion of your time towards your profession, that you are willing to do things that are outside the box of how you were trained, and that you are willing to share and collaborate with the team to actually deliver what we set out to deliver.
Wow.
And we do have a lot of fun. So I think yesterday we were out at dinner doing some painting, etc. And so we definitely keep things.
Keep yourselves happy.
Yes.
Right.
Yes.
And professionally engaged. Okay,
Yes.
29 minutes past the hour of 2 on Joy 99.7 FM. Back to special care dentistry for the elderly. You mentioned dry mouth, for example. You've also mentioned other, should I say, comorbidities, right? Apart from my oral care issues as an elderly patient or client, the likelihood that I may have diabetes, I may have Parkinson's, I may have high blood pressure, I may have prostate issues, I may have all of these things. Let's hit on some of them. This dry mouth, is it xerostomia or what is it called?
Xerostomia.
Stomia,
Yeah.
right.
So we
Why-
always...
Sorry, but why particularly would you be concerned? And you mentioned them typically sleeping with their mouths open, the kind of room condition and all that. Why is the dry mouth? Of course, you've talked about saliva, all right? But explain that concern for this particular demographic.
Okay, so we know that there are certain medications that are used in this demographic. In particular, medication for urinary frequency,
Okay.
medications for antidepressants, medications to reduce anxiety. Those sorts of medications, as well as the interaction.
Okay.
And as I alluded to, a lot of this age group are taking quite a range of medication that can be interacting with each other. And these are known to cause a dry mouth. The reason why the dry mouth is something that we need to look at is, firstly, their mouths are uncomfortable.
Okay.
You know, their mouths feel quite parched. It doesn't feel comfortable. It's very easy for them to have small cuts in their lips, cracked, tongue, fisher tongue, etc. So you find that if you're not careful, they automatically start eating less. That's going to be an issue.
Wow.
The second thing is that as we look in the mouth, and remember that the mouth is the gateway to the body, we are able to pick up certain things. And with the non-communicable diseases, high blood hypertension, diabetes, etc., we now know that there is a link with what's going on in their mouth and what we can see and what's going on in the rest of their body.
Right.
With this age group, a lot of them have already been diagnosed. Sometimes it's us who are picking things up and referring them to the GP.
Okay.
But for example, if you have a dry mouth, all of your defenses are lowered because the saliva is literally like a water pressure jet hose that's going to come and clean things once you've had something to eat. Without that, you've literally been left exposed. You are definitely at a higher risk of getting caries. And the caries actually differs in this age group. Usually, whenever we're talking about decay and holes in the mouth, we're talking about it as in the teeth.
Right.
But with this age group, it's happening between the junction of the teeth and the gum.
Right.
And the English use the expression getting long in the tooth because we find out that a lot of them, the gum actually starts to shrink
It
back,
recedes and
exposing the
shrinks.
roots.
Right.
Yeah.
So you're seeing more of the tooth that you shouldn't typically see.
Exactly. And
Right.
that part of the tooth is meant to be covered by bone and by gum. And so it's just not as strong. It doesn't have enamel. And so the moment you have a dry mouth and you have the recession, you're going to get caries in that actual area.
Right.
So, this is why having some saliva is important. And for example, one of the things which is relatively difficult to find on the market are saliva replacements. Now, you can get a little, bottle that has saliva replacement, which you squirt in your mouth once every 2 to 3 hours. And that's literally replacing some of the saliva that you are not producing.
Okie dokie. You're hearing this on Joy99.7 FM. Literally, you buy saliva.
Yes.
You need it. Your mouth should not be dry. And at that age, that is a critical indicator for what could be going wrong, right? So we need to be mindful about this. And for this particular age group, then it also means that the damage that takes place in the normally or typically visible part of the tooth, which has enamel as protection, is now targeted at the unprotected or the relatively less protected part of the teeth and is doing brisk business.
Yes, very
Unfortunately, that gated property or premise you call your mouth, right, needs the saliva to be, should I say, moderating, mitigating, eliminating some of this damage. And so in the absence of that, there's brisk damage going on.
Yes.
That's what you're saying?
Yes, and it can happen very, very quickly. We also need to remember that in this age group, a lot of the time, they're not eating enough. And so they're being encouraged to have things that have a high amount of calories in them. So we have 40 sips, Ensure. Sometimes they're being encouraged to have Lucozade, etc. So we're literally pouring sugar into them. And we are doing it for their own benefit. But in terms of the teeth, that's also, along with the xerostomia, is going to rapidly cascade into decay.
Okay, great. I've got this from FM in Pram Pram. He says, thanks for the program, Nortey. I filled my cavity when I was 35. Okay, I think he means 35 years ago. I'm now 70. And I realized the filling material used to fill the cavity is breaking in pieces. Please, what's the cause of this breakup of the filling material? Do I need to visit a dentist for a refilling? This is from FM. He is 70 now. Now, I was watching a video last night in preparation for this, right? But a woman had been wheeled into a consultancy, and she was elderly, and she had dentures that were fixed like 30-something years prior. Okay, she came in a wheelchair, but no thought had been given to what's in my mouth. Does it need redoing, rechecking, reviewing? And FM just shares this.
And I love that question because, previously, dental materials which are biocompatible, so nothing's going to go wrong, but they were stress tested.
Okay.
But we were stress testing assuming that people are going to live a certain length of time
And die.
and and not need to use their teeth anymore is
Right.
how I would like to express it.
Okay.
But now that has been considerably extended. And so, yes, some of the filling materials are going to degrade. They're not going to cause you any harm, but the filling material needs to be either topped up or changed. Because in the last 35 years, imagine the advances that there have been in terms of technology for everything. So even the materials that we actually use have totally and utterly changed. Even from when I finished training, the actual dental materials have changed. And we need to remember, and I think that we often forget this, that in our mouths, when we are chewing and we are using them, it's like an engine that's being used repetitively. And so it's not surprising that when you've had something introduced which isn't normal
By way
or
of a
part
filling,
of it,
right.
like a filling, with time, these need to be resurfaced, they need to be redone. So please, 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 I would advise that, yes, you do need to see a dentist.
FM, we're being told, FM in Pram Pram and everybody else listening, you need to do roadworthiness.
Yes.
Whether it is dentures, braces, whatever you had fixed for you, you thought you had paid once, right? You need to have them checked. the alignment to your teeth might have shifted. The filling material might be compromised. As she was speaking, I was running my tongue over a particular area in my mouth. Please, this is my private business. But hey, that's what we're talking about. And for the elderly, you could be living alone. Now you're worrying about pension and all these things. And now Nortey has brought this issue of your teeth. And when you talk about, progressive gum damage and all those things, I can imagine an elderly person who is managing pain as a result of this, but may not express it, right? And therefore, we may not take it seriously because we're not aware of it, right? So these are serious issues. Novishi, let me just announce my phone line, 0302216541, 0302216541. We're talking about your teeth. And even if you're not there, you will get there. The percentage of elderly, projected to increase. Indeed, my reading suggests that we lead in that percentage in the sub-region, right? And we are moving very quickly. People are living longer. There's reduced fertility and many other things that are impacting on this demographic. So it's something we need to take seriously. If you have any questions, concerns, experiences, confessions, 030-221-6541. This is Ultimate Health on Joy 99.7 FM. And we're talking about dental care for the elderly. Yes, Doc.
So the other major thing with the elderly has to do with the supporting structures around their teeth. So when we look at the general population and then we compare them to the elderly, periodontitis, which is when you have an infection or inflammation of your gum, and when the supporting structures, so you are basically losing some of the bone around the teeth, is as prevalent as 68% in this age group. So it's almost more rare not to have it than to have it.
It's almost like the common cold in dentistry for the elderly.
It's literally, yes.
Wow.
And this, again, requires us to do a lot of maintenance to prevent the bone moving down. And some people will say, but why is the bone so important?
Right.
The bone is important for keeping the teeth in the mouth.
Okay.
And the bone is important to stop them actually drifting. So sometimes we get faced with challenges. You have an elderly person sitting there, they're having a problem with one tooth, and the mindset seems to be, let's just get rid of that tooth and then the problem is gone. But we know that the moment we get rid of that tooth, all the other teeth are going to drift. And they're all going to shift. Then our concern is that that person will now stop using that side of their mouth.
It's called alignment.
Then,
Doc, let me just stop you and take Barbara. I think it's Barbara on our phone line. No, Babs. Okay. Hello. Good afternoon.
Hello.
Yes, good afternoon. Who am I speaking to?
This is Babs from Abelinki.
Babs, you're welcome. Share with us.
Yeah, good afternoon, Nortey, and good afternoon to the doctor. Unfortunately, I cannot laugh because I have a broken front teeth. So I want to ask the doc if they replace teeth. And then my second solution is it good for the elderly? Like she's saying, you can't buy saliva in the market. What about the elderly chewing gum? If they can chew gum, maybe it can add up to the saliva, bringing the saliva.
Okay, right.
It's just a solution.
Okay,
but with my teeth, I just need their number so that I can come there.
No problem. But you didn't give us your age. Are you in this age group, Babs?
No, I'm in my late 40s.
In your late 40s. Okay.
Yeah.
All right. Give your number to Abeku and then we can see how we can bridge you, right? And get you some help. Okie dokie. I have Oti, I believe from Tema. Oti, my brother.
Good afternoon.
Yes, Oti, you're welcome. Share with us.
Yeah, thank you. I want to ask you, how can if you get getting older, you maintain your white teeth and the strong teeth? What should you do?
Oti, there seems to be a problem with your line. I can't hear you clearly.
Hold on.
Try again.
How can you hear me now? Yes, go ahead. That's clear now.
Yeah, go ahead quickly.
Yeah. How can you maintain the strong teeth and your whitening teeth? Because you see them, they are getting old, their teeth getting brownish, you don't know the blood is coming through their teeth or something. How become the stronger and whiter?
Okay. Right. Stronger and whiter. He says he's noticed, should I say, some kind of deterioration over time with age, right? He wants the teeth to be strong, but he wants them to be white, okay? I'm reading a bit about platinum, and whitening is your league leader, right? Yes. But we'll come to that. And then Babs was asking his question about he's got broken teeth, and then he was also asking if these can be replaced.
Yeah, so I'll deal with Bab's question first. It was actually a brilliant question because he also touched on whether chewing gum will actually help with the saliva. Now, everything has to be diagnosed. So sometimes it is that your salivary glands cannot actually produce saliva.
Okay.
So then the chewing gum doesn't help, but that is rare. So yes, chewing gum, but please make sure it's sugar-free gum.
To stimulate the production of saliva.
To actually stimulate production of saliva.
Okay.
Sipping water, another really, really good way of actually doing that. Broken teeth should and can definitely be fixed, especially when they're at the front of the mouth. Remember that other than the function, this is also going to impair on the aesthetic of things, which has a marked effect on your confidence.
Yeah.
So we really, really need to be looking at health, not just as the prevention of disease, but also the social interaction that goes with people's lives.
Right.
So Babs, that's what I'll say for you. And then the second question was about whiter and stronger and the elderly. You're perfectly right. We need to remember that teeth come in layers and that we have the enamel and then we have dentine and then we have pulp. And enamel is pretty much white, dentine is pretty much yellowish, pulp is pretty much reddish. And with age, as you brush, especially if you use tools that you shouldn't be using, and if you use extremely abrasive things, you end up actually removing the enamel, which means that the dentine, which is more yellow, starts to show through.
Okay.
And then once you end up removing a lot of the dentine, usually you should experience some pain by then, but then you do get a reddish tinge that then starts to come through.
Wow.
However, all of those can be rectified, they can be masked, and so things can be made to look strong, made to look better and whiter, and they can actually be made stronger.
Okay, great stuff. Wow, 45 minutes past the hour of 2 already. We can still call us 0302 216541. WhatsApp is 055 11 997. It's still Ultimate Health, your ultimate guide to healthy living. Now I have to speed up and it becomes a mouthful and I'll need a dentist. But I've got one in the studio. These are very, very basic procedures that can be explained to you, and quickly you can be aligned, so to speak, onto the right path and doing the right things that correct some of these things and manage them.
Yes.
Right? And for the elderly, we need to get into this business with them because in that age group, this is critical. Right?
Yes.
To their quality of life, their comfort, and everything. Now that we talk about it, Charlie, you're sitting there with a dry mouth. Okay, maybe you've been left at home. We make sure you move from the bedroom to the sitting room, the TV is on, and you're on your own. Okay, all this could be bothering you and nobody really is paying attention to it. So this is why this is important. This is from Dede in Maryland, my good friend. You still are not in Ghana. Okay, I understand that as one ages, the jawbone shrinks, which also affects the alignment of the teeth. What can be done to prevent this? Bone and gum chewing, what adverse effect does it have on the teeth? Dede always ask 3 questions in one. And she will check if I've answered all of them. Yeah, so is there a shrinking of the jawbone? Okay. And does that affect or compromise the alignment of the teeth, right? And, you know, all these are suggesting programs we have to do. And then what can this be prevented? Okay, and then bone and gum chewing. She's talking about chewing bones, which is a pastime that some people enjoy, right? More than dogs, right? Does this have an adverse effect?
So I will start with the latter. in a healthy dentition, chewing bones should not have any adverse effect at all. If anything, you're introducing more calcium from the bones, and when the teeth are forming, then that should actually be strengthening the bones rather than taking anything away from it. But please remember that caveat. That's in a healthy dentition.
Okay.
The second question about shrinking bone, we need to be very, very careful about this. Everybody will lose a little bit of the height. So not the width or the volume, but the height of bones around their teeth. Okay. But when we're talking about loss in a healthy mouth, we're talking about losing 1.5 to 2 millimeters over about 60 years.
Wow.
But what we're talking about when we're talking about periodontitis is when people are losing 6 millimeters, 8 millimeters, and that's a totally and utterly different thing. And once you've lost that degree of support, then the teeth will actually move around. Okay. We also need to understand that the teeth...
Can I just interject? Move around, would they stay around? Because interestingly, though we're talking about the elderly, we haven't talked about tooth loss, right? We are literally talking as if all of us will retain our teeth, okay? Of course, some will lose some, and then this misalignment and drifting, But when you say, will the teeth stay?
They move around until they move out of the mouth.
Okay, so you lose them.
Yes.
So you actually lose them.
You can, yes.
Okay.
Yes. And a lot of elderly people lose a lot of teeth.
Right.
But again, this is preventable if caught early. Okay. And we need to remember that, especially when we're talking about bone loss, things like diabetes literally contribute, and all of these are interwoven.
Contribute and complicate.
Exactly.
Right.
So we are also looking at the health factors rather than just the teeth themselves.
All right. So you do need a specialist or an experienced person, not just your tooth, not just the remission or relief from symptoms. We need to know what's going on in your mouth, and that needs to be addressed. Okay. Roots, not fruits, right? We need to get in there. 030-221-6541. WhatsApp is 055-1111-997. We're live on Facebook and YouTube. My guest is Dr. Novishi Akutu. She's a consultant orthodontist with the Platinum Orthodontics and Advanced Dentistry. And we're all advanced this afternoon, but my listeners are also advanced. FM in Pram Pram says, yes, the dry mouth is experienced when I'm asleep. I do have to wake up mid of my sleep to sip water and to put a small toffee in my mouth to induce saliva, and it works for me without any side effects. But you haven't talked about what's in the toffee. Okay, so thanks for sharing that. Let me just quickly clear the WhatsApp. Who else is in there? Good afternoon, Nortey by nature. I love it when you say Nortey by nature, not naughty by nature. Please, what is the cause of gum bleeding, and is there a cure? Gabriel K. Danso in Dahwenya. Okie dokie. This one says, good afternoon, please. I'm having sensitivity on one of my teeth when I eat orange. Please, any help? Leave the orange alone. But then again, we need to know what exactly is going on. Ni in Dakuman, thanks for sharing that. Dede in Maryland comes back. Which toothbrush is recommended and why? Dede, I know your age, but I won't share. All right. Which toothbrush is recommended and why? I would like to assume this is in relation to the elderly. Okay, you made some comments on the ability to hold a conventional toothbrush, changes that can be made, but Dede is asking this one from Maryland, and I'm assuming that it's with regard to the elderly.
Okay, so with regards to the elderly, your perfect ideal toothbrush is going to be an electric toothbrush, with no questions. If that is not an option, or the elderly prefer to use manual toothbrush, you need to look at the size of the handle.
The handle.
You can use anything from Velcro to increase the size of the handle to a bicycle handle, just so that they are able to grip.
It's easier to grip and maintain the positioning.
Exactly.
Right.
And then the second thing is to look at the bristles. We don't want anything harder than medium, so soft or medium bristles. And a relatively small to medium-sized head. So those would be the recommendations when it comes to brushing for the elderly.
Righty. I wanted to ask, I look in the mirror for different reasons, okay? Again, we're talking about bone. We're hearing gum, right? Is the gum bone or flesh or both?
The gum is flesh.
It's flesh.
Yes. So you have tooth, and then you have bone, and then you have gum.
Right. Okay. So when you have this recession or the receding gums, you're losing flesh.
You're losing flesh, and then you lose the bone as well.
Okay.
And then now you can see the root of the tooth.
Which should not be the case.
Which should not be the case.
So when you're seeing more of the tooth, right, and its roots exposed, you're in big trouble.
You're in trouble. However, we can help you. That's what we do.
Folks, I'm the host here, but you see a dentist chuckling at my pain. Can you imagine? It's not that she's happy about your pain or what damage is underway, but she's so passionate about dentistry. It's the only thing we don't fight about. But so really that's what's taking place. You're losing. Okay, she's got something that can demonstrate for those who are watching us on YouTube or Facebook, right?
Yeah. So we have the teeth here, and then you can see a pink part, which is the gum.
All right.
But underneath this pink part, you have bone. So if I turn it around so you can see on the inside, and then you have the roots of the teeth here. So it's when the gum starts to go down, and then you can see more of the actual tooth.
Okay.
And usually it comes with sensitivity.
All right.
So it becomes a bit sore in that area.
Okay, right. If you have any questions, concerns, squeeze them in. We've got about 6 minutes left. 030-221-6541. 055-1111-997 is WhatsApp. We're in the company of Dr. Novishi Akutu. Yes, she was here, started at Red Church School, split around the age of 2 when she couldn't buy an air ticket, but grew up in various parts of the continent. I think Kenya, Zambia, did some education there, went to the UK and grabbed all the top honors in, I'll get to that next week probably, right? But she's this lead clinician and consultant orthodontist at Platinum here in Accra. Platinum Dental, they are celebrating 10 years of fiddling with our teeth and helping us do the right things. If you have any questions, concerns, 030-221-6541. Gosh, I've got more in my WhatsApp cavity. Okay, let me see what it says. Please, I always have bleeding gums, whether brushing or not. Sometimes it occurs when I'm not brushing or pasting at all. This is from Eric in Kwanta in the Oti region. Doc might comment on that. Okay, no age reference there. Good afternoon. I'm Eddie from Ashaleboche. Where are you, Eddie? Okay. Yep. I'm approaching 69 in the next 3 months. I regularly experience very dry mouth in the night. I have to quickly wake up and sip some water. I cool my room for about an hour and then turn off the AC before sleeping. What is happening to me? Well, we've already talked about you, but in many respects, some of these concerns were raised by Dr. Akutu. I'll pass this back to her. Let me read a couple more. Hello, Nortey. I keep applying lip gloss and Vaseline lip cream to my lips. Been doing it for years. But my lips are still cracked and wrinkled. It has affected my self-esteem. Please ask your guest, what's the remedy for my lips? Stanley Nachimota, send your age, not your lips, right? And then Doc will comment on that. Let me read a couple more, trying to do both sides of the divide. This one says... Hello, greetings, Mr. Nortey and Ultimate Team. Please, I'm just imagining X-ray of the teeth. Oh my God. Of your teeth, my teeth, or okay, right? Let's answer a couple of those. Lips.
Okay, so I'll lead with the lips and lip balm. with the elderly, we talked about some of them not having teeth and wearing dentures.
Okay.
And denture health, etc., changes the bacteria in the mouth.
Okay.
So for the person having cracked lips, if you've been using lip gloss and it's not working, it's worth going to see the dentist. Sometimes you have a fungal infection called angular colitis, which can be just at the corners of the mouth.
Okay.
And a prescription for 7 to 10 days will actually solve that for you.
Whoa.
Moving on to the gentleman about the dry mouth in the middle of the night. Really, really simple solution. Try and leave a saucer of water close to your air condition. And you may find that there's just more moisture in the air. And that can actually help. Because as I said, fans, heaters, air conditions can really, really dry out the mouth. And especially for that age group, first of all, congratulations for your birthday, which is in 3 months. And part of the issue is that a lot of this age group sleep with their mouth open. And so you have this desiccating effect, and that can be tempered just by leaving some water out. You'll be shocked that you leave quite a large amount out, and within a week it will all evaporate and disappear.
Okay.
So that's a very simple remedy to try.
Okay. Don't sleep by the sea, by the way, or the river, right? Use Dr. Akutu's solution there. The bleeding gum, whether pasting or brushing or not.
This person needs to go and see a dentist.
Okay.
We always say you wouldn't not go and see an ophthalmologist if your eyes were bleeding.
Okay.
You would rush. So think of your teeth in exactly the same way.
Okay.
They definitely have some issue going on with the gum and the bone around the gum, and the sooner that is attended to, the better.
Okay, great stuff. Good afternoon. I'm diabetic and I sometimes have a dry mouth and my teeth are getting brown. I am 56 years old. Any comment?
Yes, diabetes, oral health, real huge links. Not necessarily about the color of the teeth, but how the supporting structures are.
Okay.
So this is a group that need to see the dentist regularly.
All right.
Because we need to be more proactive
Okay.
in terms of maintenance to stop you getting ulcers, infections around the teeth, where your diabetes means that you're not going to be able to heal as quickly as other people.
Okie dokie. I'm looking at you. I wanted you to say all that in Ewe, but I won't go there. Hello, Nortey, and good afternoon. Please, I always have dried lips, and I'm 28 years old. Am I okay? This is from Celestina in Adan. Any quick comment?
Quick comment, go and see a dentist. I think we just spoke about this. If it's something that is actually persistent, there may be an underlying cause, and we need to look at the underlying cause.
Okie dokie. Dede in Maryland is back. Does Platinum accept health insurance from outside Ghana?
Yes, we do. We accept quite a few of them. Cigna, Aetna, Allianz. And even if we don't, we'll fill out the necessary forms so that you can reclaim from them.
Okie dokie. Hello, Nortey. My problem is dry mouth and bitterness in the mouth, and I experience this more at night. I sip water during the night. I'm 60 years plus. Same thing, huh?
Yes.
Okay, let me quickly, we're already at 3 o'clock, huh? Good afternoon, I'm diabetic. I always, okay, that's just saying thank you. Alrighty, it's 3 o'clock. I can't believe it. Doc, we still have to do a lot more for the elderly, and from the traffic we have, WhatsApp, there is a demand. Right, there's a need, and there's a lot of work or unmet need. So we'll have to bring you back for some of the other issues. We talked about the dry mouth, we talked about the gum disease, and a few other things. We haven't even talked about what you do to fix it.
No,
right?
We talked about oral cancer or clenching
We
or
haven't talked
bruxism.
any of those things, right? So we'll have to make time, shuffle around, and get you or some other member of your team to come in. Congratulations on this awesome milestone.
Thank you.
I know one of the key things you push is the platinum experience. Right? Yes, you've talked about the design of the building. It's not as if you converted a classroom into a dental practice. So it was done purposely for this. And you've chalked this milestone. What do you want to leave us with, even as we ask for more and posture to have you maybe next week?
What I'd like to leave your audience with is is the fact that there is a wealth of growth in dentistry all over Accra, not just at Platinum. And what we really, really want you to do is to start valuing your oral health and working with your dentist to actually achieve the goals that you wish to achieve in a safe way, and which can lead to longevity. And the aim is for us to keep your teeth and to make sure that you are and have a beautiful smile. So one of our slogans is that everybody deserves a beautiful smile.
Everybody deserves a beautiful smile. And if you don't have one, we'll make one for you. We'll get you one.
Yes.
And we'll sort it out. And for those who are talking about broken teeth and front teeth and all that, we have had the, should I say, singular privilege of helping a young man, Joshua Ayinga. He was involved in a road traffic accident, and back then, Platinum had a very, very, very nice gentleman, a doctor, a dentist called McLean. Can you imagine? A dentist called McLean. He's out, I believe, for further studies.
Yes.
Right? But Joshua is in constant contact with me, and his smile is intact. Many thanks to you at Platinum for doing that. I think we've done a lot of other fixed jobs with you. But we'll see how we can keep Accra smiling, right? Because this is not just a 1 week anniversary at all, right? You guys have got a roadmap for a year and beyond.
Yes. So we're extending it to a year, and we have some activities, some very specific activities.
All right.
That's our program.
Okay. We'll come back with their smile and the activities, but more importantly, the elderly. We're going to zoom in on this, and I'll see if I can, twist her arm to get a couple of our listeners to, benefit from some basic procedures. She's already nodding. Just say yo.
Yo.
Akpesia, Dr. Novishi Akutu of the Platinum Orthodontics and Advanced Dentistry. Happy anniversary. We're out of time, way past time. I'm out of here. My name is Nortey by nature. Many thanks to you, my discerning listeners, and of course, my producer, Abeku. Stick and stay. Don't go away at all.